All right, and go ahead, Chris. Oh, sorry, Craig didn't get to say hi to everyone.
Hey everybody, got unmute yourself, type in, you know the drill.
I say that, I can't hear anything. Just a sec. Go ahead, Chris.
Can you hear me now?
Yes, there we go.
Oh, awesome. Thank you. Thanks, Sam. Hi, Greg. You're
Hey,
home.
how are you? I know we're
I'm
home.
good, thanks. Hey, just wanted to get some guidance from you. I have a couple friends. Very similar situations happen. You know, they've been married for a long time, over 15 years, both of them. Um, all of a sudden, didn't see it coming from anywhere. The husband wants a divorce, you know, so the rug's been pulled underneath from them. There's the shock and every other emotion that comes with that. So I wanted some help on breaking down how to start healing, both with oils and with pranic healing.
Any chance of like trying to save the relationship, or is it like
I'm
done?
I'm hoping so. In Washington, you're given 60 days to try to talk things through. Um,
Right.
I don't know the details. They haven't come to see me yet.
It's not like they've been
It's
fighting and that you're
no
aware of. It's just all of a sudden.
one, no sign. They just, came from a fabulous trip. All of a sudden. Yeah, and then the other one may have. The other one is an older couple. Maybe some, I don't know, uh, restlessness going on there
So,
with their husbands.
okay.
With the
So,
husband, sorry.
what are the ages? Like, what are the ages of the
One is mid-30s. The other one is mid-40s.
like lower end of 40 or higher end of
Mid.
mid?
Mid.
Okay.
That one is brand new. The other one
Yeah.
has,
And the other
it's
one's
probably a few weeks.
mid 30s.
Yeah, mid-30s. That one, they were planning for a baby and
Yeah.
she came from a fabulous trip. All of a sudden,
I
boom,
mean, it's
bought a
it's
house.
hard. Yeah, it's
Yeah.
hard to say because you don't know all the dynamics, but like let's
Right.
just look at it from the place that we know. And
Yes.
so part of why I was asking the age is, if you go through and you look at Kabbalistic cycles, Venus is tied to age 35 to 42, and that is like harvesting the things that have been sown and being able to kind of kick back and ride the wave of the things that you've done in the previous part of your life. But the other component of it is that particular period is always a potential for like a midlife crisis. The red sports
Yes.
car, the I want something different, that can happen. And a lot of times, if you are able to, like, it doesn't happen every time, but it's where the potential is, and of course it can happen at any time, but I mean, it happens so much that they have a term midlife crisis because it happens so much. And so, one of the goals sometimes is to help people just survive that time frame. And if their relationship is strong, it usually bounces back. It's hard to say because you don't know what's going on, and so these are the things that I like to do in situations like this. And by going through and doing these things, it's not forcing the situation. That, like, if it's really like they don't want to be together or something, you're not going to like force the issue. But if it's just like somebody just lost their focus for a little bit, let's say, or lost their,
Yeah.
you know, their, 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 their feet aren't under them, so to speak. You know what I mean? Or there
Right.
could be a little bit of arguing that at some point the person just goes, enough. Sometimes it's even displaced. Like for example, like I knew this, he was an undercover officer actually, and he had worked super hard to become this undercover officer, and it was like on the West Coast, like it was in a district that was really hard to get into, like San
Uh-huh.
Francisco area. And he had a really weird relationship with his dad, and he was trying to connect with his dad, and his dad just basically told him, I don't want to have any of this, like, I really don't kind of like interacting with you. Then he, at the same time, he was dating somebody, a woman in his department that ended up deciding that she was really more into women than men. And so, both those situations, he was out of control. And so when I saw him, he's like, I'm going to quit my job. And I was like, you love that job. Why are you going to quit it? And he's like, I don't know. And he just got it in his head. He didn't have power in any other place of his life, but that was the only place where he had power. And it wasn't about trying to save anything. He was just trying to like exert his power. Like I have some say so in all of this. And he ended up quitting his job. And then about a month went by, and he went, oh my God, what did I do? And
Yeah.
I tried to talk him out of it. And that's the thing is, trying to talk somebody out of it. There is for a long time, there's a separation between the intellect and the heart, or how we feel. And people can like understand something intellectually, but then when they go in their feelings, it could be completely opposite of what they think. And a lot of times they'll act out on more of the feeling rather than the thought. And so that's why it's very important, like over a period of time, to cultivate that integration of the mind and the emotions, so that you start to have the intelligence of the heart, like, mental faculties, but like heart centered at the same time. And so like here, I would say this is probably one of those examples where, like, if you look at it logically, they've either talked themselves out of it or into it. And then there's the emotions of like, and so a lot of times there is no logical way to address this. So you turn to like applying energetic medicine, or here we're looking at it from plant medicine, but plant medicine still being tied to the energetic component, right? A lot of times we're looking at like how this does the physiology, how this does this and that, but here we're trying to give every opportunity for somebody to not walk away from something that, like the cop did, was like, this is the only place where I feel like I have power. And so given what's happened in society over the last 3 years, I would say there's a lot of people who feel that life is out of control, and this is the one thing I can control, and so we don't really know all the details. And sometimes even if you ask the person, they might not know the details. So what I start to do, and it really depends on how much everybody's willing to do here. You know what I mean? Like the person who's leaving, the male, the husband, probably is not going to want to do anything. So you're really going to have to focus on more of the female, and try to do things that way. So here's a couple of things that I would suggest, that it just, sometimes it's almost like you're trying to buy time for gravity to set in, and somebody to go, the reality of this is like, what am I doing? What am I thinking? You know what I mean? And so if it's because of stress at work, or maybe there was some little weird conflict, or there's the lack of communication, this potentially helps to open that up, right? And then if it doesn't work, then at least you tried. So the very first thing that I would do is but between the two partners, they need to clean cords between
Right.
each other, and that could be done by one person. It doesn't need to be done by both. So here you have a couple of choices: the etheric cord blend, or just the good old-fashioned ironbark eucalyptus. Ironbark eucalyptus, it's very lemony. It's doesn't smell like normal eucalyptuses, but the thing where it really, really shines is it gives you like kind of an uplifting feel, like uplifting sensation. It does reduce some fears a little bit, but it really cleans the energetic connection between, you and whoever you're courted with. And here I would say have the wife sit and think of the husband while they inhale the ironbark eucalyptus.
Okay.
And I mean, I would do it like daily, because basically what that does is it helps to increase the connection between the two of them. And so, I mean, best case scenario is maybe they talk it out and they're able to work it out. That's best case. Like worst case would be, they still end up having a divorce, but maybe they're able to be like communicate more and be gentler with each other. You know what I mean? Because even though they might be neutral right now, when it starts getting down to, the details, people can do weird things. They can do really super weird things. And so,
And Greg, will that address, one of them mentioned that there's something very toxic going on in the family that would address that too, right?
I would think, I mean, that's what I usually look for. Like when I was doing therapy full time, it's like toxic thing in the family, toxic thing at work, there's been an incident, or there's the person is, there's a little bit of like agitation and conflict between somebody, or they're starting to have like some sort of emotional relationship with somebody either on the internet or in the workplace, or it's all of those. And not pointing fingers, but just trying to reestablish the connection of like, hey, let's get back to this, right?
Mm-hmm.
And so the ironbark eucalyptus is very helpful. And even if there is a toxic situation in the family that's not about them, but like, other family members are being weird or whatever, that energy is still flowing between them. Like say somebody's like super upset with the husband or the wife, and then they start interacting and they still feel positive about each other, but the energy from a bunch of people being angry at one person, that still works into the mix of this back and forth between the two people. And so, it's just the energy body gets a little dirty, their body gets a little agitated, and neuroreceptor sites start picking up on things, it happens.
Mm-hmm.
And so I would go pretty heavy on the ironbark eucalyptus. And I know that sounds like a really simple thing, but I like that. The other thing that I like is also the African bluegrass, just because it helps and improve like moods and things. And sometimes some of the mood related issues, and before I start spouting off of this, I want to be sure that I'm saying this right. Mood. Yeah, so like mood can very much affect issues associated with the will, right? Like, so I want what I want, I'm not backing down, or defensive, whatever it is. Like it can affect the will, like sometimes in a good way or a negative way, depending if the mood is good or if the mood is bad. And so like when somebody is a little bit moody, the will aspect can get a little bit agitated, and if it's not tempered with like love and light, the tendency for that is separation, right? Like the will is very dividing, where love is very like bonding and connecting. The will is dividing. And so I don't think you need to go through and treat like the will itself. I just think like if you improve the mood of an individual, the will aspects usually follow. And so, you know, the wife could be inhaling it, wearing it on her skin, but she could also be wearing it on her skin when she's in the house, or diffusing it in the house.
Okay.
That would be strongly suggested. And then the other one is I usually have somebody with like marital issues use rose mixed with frankincense. And just in the environment, or if they take a drop and ingest it, or, you know, give a drop to the husband, or just diffuse it, or wear it as a perfume, get it in the area, you know, get it.
Is there a blend for that, or?
There's not, but I can make it for you. Like we can make it, I can have it shipped out
Thank you.
tomorrow, but I can also tell you like how to do it.
Okay.
If you have rose, and any sort of rose would work. I wouldn't use like geranium or something. I mean, I would use rose.
Okay.
I was doing 3 parts rose to 2 parts frankincense.
Uh-huh.
So 3 rose, 2 frankincense, regardless of what kind of rose it is. I mean, most times I would just use the absolute because it's more inexpensive, and it has like kind of a more hit you over the head kind of fragrance, where some of the other roses are strong, but they're a bit more subtle. And rose absolute is like when you smell it, you're like, oh, rose. Where you smell Bulgarian rose, it's like, what's that floral smell? Like, you know what I mean? It's not like we kind of need to hit people over the head in this situation. And so I tend, and it's way less expensive. And so I tend to go that route. If you were to do anything else, those would be the top 3 things that I would do. If you were to do anything else, Solomon's hyssop, you know, we're doing the Saint Lafon technique, and we haven't got to the week where we're doing Solomon's hyssop, but part of what Solomon hyssop is for is to reduce and minimize the tendency for us to like project, right? And so it's not just diminishing the tendency to project, because we all do it. But what happens is, say we have a bad day, or we're irritated with the family or whatever, you just kind of start like projecting like a bunch of negative thought forms in the area, and then after a while you're in this soup of these negative thought forms that are not about anybody in particular, but like a goldfish in a bowl of water. If there's a bunch of stuff in that water, it's affecting that goldfish. And the same thing happens to the environment, and can actually even happen in the energy body or the aura. And so, you know, this is why King Solomon used Solomon's hyssop. This blend that he uses is he did it for materialization and for like what we would call Kriya Shakti or manifestation. And it was to reduce the negative projections that we do unconsciously, because a lot of times it's not even that we consciously do it. It's just you're agitated and you just start putting out like agitated thought forms, and then somebody's angry at you and you get defensive, and then you put out defensive thought forms, and then, you know, whatever it is, you kind of kick out this energy. And so the idea of using Solomon's hyssop to clean up the environment is always a good idea.
So diffuse that?
You could diffuse it, you could burn an incense. Again, people could use it like a salt scrub or in a bath. Yeah, any version of that. Just get it in the area, like a spray, you know, whatever. Yeah. So I mean, I think those 4 are pretty solid. You know, if we knew more details, we could go down the rabbit hole. But this is just general, like, how do we try to allow these 2 people to potentially work it out and not be as reactive? And you know, have a little bit of time so that, you know, they can come to terms with it or work it out. And so that's usually what I would do. As far as pH is concerned, visualize relationship, paint it, you know, like paint it blue for a really long time, and then disintegrate with electric violet.
Okay. How about the wife's energy body?
I'm actually more concerned about chords than I am about her energy body. Like I think if the connection would happen, things would get better. I mean, you can always clean up like the solar plexus and everything, but it's more about a dynamic between the two people. And so the whiteboard, you know, blue and electric violet, knocks out a lot of it, because it's a bouncing back and forth between their energy bodies.
Right. And then there's that, you know, panic and fear.
Oh yeah.
So
Yeah,
just do the EV on all the chakras, right? Arms and legs.
I mean, if the fear is really intense, clean the arms and the legs with electric violet.
Okay.
Like I wouldn't even worry about the chakras, just clean out the arms and legs.
Got it.
Yeah.
All right. Well, thank you so much, Greg.
You're so welcome, and keep us posted. Like if you need to problem solve or troubleshoot something in that area, let me know. I mean, it's with everything happening in the last few years, you know, people have been bringing stuff like that to my attention a lot. It's not, I wouldn't say it's common, but it's happening a little bit more than it used to. You know what I mean?
Yeah, I was surprised. Two in a row.
Yeah.
Yeah. All right.
You know, think about it like this, like when a country is like at war for a period of time, it doesn't matter how good the people are running the country, people get tired of it at some point and they're just like, I need a change. And so sometimes there might be like the lack of connection or the conflict in another part of the family, or there's just something. And with everything going on for the last 3 years, it's like a little bit like being in wartime. And at sometimes people just kind of internally snap a little bit.
Right.
And this kind of helps like kind of try to reel all that back in.
Got it.
Yeah.
Got a plan.
Yeah.
Thank you so much.
You're so welcome. Keep me posted on that.
I will. Thank you.
You're so welcome.
I just want to do a real clarification. You had mentioned for the rose ingest, the rose with the frankincense, the rose absolute, can that be ingested?
It'd be better if that for that part it wasn't rose absolute, but I've done it several times. It's better if it's like the Bulgarian rose or Turkish rose or alba. If you're using the rose absolute, I mean, most likely in this situation, they're just going to be inhaling it. The person's going to be wearing it. It should be fine for that. So I doubt the husband's going to say, okay, I'll take these few drops of rose, but you know what I mean? They're not going to be, because I'm not so much worried about the wife. That would be more for the husband. And so I didn't really think that was on the table, but I have done that. But the other thing is like the rose spray, you know, like just be spraying it around the house, and you could spray the energy body of the husband, you know, like visualize him and just, you know, do stuff like that. But that's probably about as close as you're going to get.
Okay. Yeah. And then I might reach out for that blend, Greg.
Yeah. Just let me know. I'll be glad to make that for you.
Thank you so much.
Yeah. I mean, there's a bunch of things that I have in my recipe book that I just don't plop up on the site because it's like real super specific for something, or I just make it as a situation needs it. So.
And then
I wonder if you'll name that that blend.
Yeah, I think in my book it just says rose / frankincense. It doesn't even have a name.
Yeah. All right. Thank you again.
You're so welcome.
And just one more clarification. You had mentioned that the Solomon's hyssop reduces the negative projections. Does it also reduce the positive projections?
Nope, it actually just reduces the real low vibration the projections are almost like resistances, and so it just reduces that, you know.
And then go ahead, Bill or Myasha.
Hey.
There. I had a question. We have a 86-year young client, and I've been keeping notes since 2019. We've been using the plant prana oils and doing some different protocols. She's dealing with both knees have arthritis, bone on bone, friction, no cartilage. But anyway, we've been charting some success. However, in the last 6 months or a year, she's been breaking out with these skin irritations on her knees. So I have suspended using the oils because trying to figure out what these, skin irritations are about. So,
and describe the skin irritations to me. What do they look like?
Oh God, they're kind of just stabbing over now.
But they were like flat, or were they raised, or did they
kind of combination of both. Yeah, they look, they go like from a rash to what you just described. Real reddish, real irritated looking. So I've just taken her off all the oils altogether and just sort of at a loss what to do.
And were you doing them neat, or were you doing them in a carrier oil?
We were doing mostly carrier oils. Sometime I would do a liniment or a lotion, just trying to see what may be more comforting than others. I initially stopped doing things via neat altogether and just went to more lotions and liniment applications. So
okay. And so she's 86. What was your carrier oil? I'm just curious.
We've done
it sounds like you rotated them, so okay.
Yes.
So yeah, let's not even bother going down that rabbit hole. Okay, so she's 86. Does she have inflammatory issues anywhere else? Like, is she having like issues in her back, or like hips, or shoulders?
I would say hip. Yeah, I would say hip, and
yeah. Okay. So what happens a lot of times when something is bone on bone like this, you see it usually more in either hips or knees. Like when it's in the vertebrae, it's basically what we're saying is weight bearing joints, right?
Mm-hmm.
And so when you see it in the vertebrae, that joint is not as big and doesn't quite have the movement that the knee and the hip have. And so what happens when they're bone on bone, at some point, because the two bones are rubbing and they don't have the padding and the cartilage to keep that wear, to keep that wear from happening. And so it's always generating some inflammatory material, right? So the area in and around the knees gets inflamed, and there starts to be what you would call like inflammatory material, let's just say, in that area. And so what happens over a period of time is the lymphatic system keeps like picking it up and getting rid of it, and then it can't pick up quite all of it, but it gets some of it, and then the lymphatic system starts slowing down a little bit. It's just this long kind of slow process. And what happens at some point is that inflammation goes from being localized and becomes systemic, like it starts to spread all over the body. And so then you start having issues where like the shoulders, the hips, things just start getting inflamed because that inflammatory material is just like in the wind, so to speak. And so with something like that, you're still wanting to reduce inflammation, but it goes from being just in that area to really trying to cut inflammation in the whole body and stimulating lymphatic movement in the whole body. And one of the areas that you really want to focus on is not just the limbs and the joints, but the gut. You want to really make sure that the gut has a lot of lymphatic movement there. And so there's different ways of doing it, but like any approaches, you gotta, like, even though the gut's not really playing a big role in the joints itself directly, a lot of times the greatest level of lymphatic stagnation and inflammatory material is in the digestive tract. Even though it might not be coming from the digestive tract, it gets like stuck in the digestive tract. And so I would flush that out quite substantially. And, it's hard when like the topical things stop working. I mean, it does happen, especially when the person starts to become a bit more systemic rather than localized. And so sometimes you do have to kind of switch over and treat it more from an internal point of view rather than like doing the topical things. So they're, having them use like turmeric. I usually go to some sort of digestive enzyme, but in between their meals, not with their meals.
Okay.
And the one that I like to use is Wobazyme, which is designed specifically for soft tissue issues. I mean, it's basically an anti-inflammatory that or a digestive enzyme that's made for its anti-inflammatory applications for soft tissue issues like arthritis and whiplash, things like that. And so start them off at 1 capsule between each meal, and eventually they can move up to 2 or 3, but like let their body tolerate it for a while. I would do that, and then internally also like black cumin oil or black seed from the health food store, something like that. And I would give them a kind of a decent sized dosage. The other thing that I would do essential oil wise would be to use Sylvester pine. And I mean 6-8 drops, but not on the knees. Like do it like up on the wrists, like the wrists or the top of her feet. And the idea is that the Sylvester pine will help stimulate the body's production of cortisone. And so it's a way to try to reduce some of that inflammation and that inflammatory response. I mean, it does take some of the achiness out, but it's not going to fix everything, but it's still going to make things more comfortable, and it can slow down the systemic like response or the reaction. And so all of these usually help. I mean, it depends. Here's the issue is that you could say, like, we have our physical age, we have our emotional age, we have our mental age, and it is what it is, right? But you could say that the immune system has its own age as well, depending on how much stress, how much difficulty, but how much stress the person's gone through in their lifetime and how much they've had to deal with inflammation. And so sometimes the immune system gets like taxed and starts acting like an immune system of an older individual. Like, they might be 80 here, but the immune system might be behaving like 100, right? And so it's always good to step back and look at, like, how can we make the immune system function better? And so, that blend that we used in the immune class, the Inflamend, it's anti-inflammatory, but what you're trying to do is you're trying to reset the inflammatory response. And sometimes you have to do things like jump starting lymph nodes and even sometimes just even increasing the body's ability to deal with viruses and bacteria, which has nothing to do with arthritis, but you're just trying to like get that immune system like going again. You know what I mean?
Okay.
And so, I always look at the thymus. Sometimes I even look at the thyroid. I also look at just the overall health of the skin, which here I think the body is trying to detoxify the inflammatory material, like literally through the skin.
Mhm.
And so anytime you have a big component like that, I always look at the digestive tract, which we already were kind of visiting, but I also look at the lungs. You know, like if the lungs are like they're breathing deep enough, if they're getting good oxygen, if there is a constriction or inflammation in the respiratory tract, if there's a lot of mucus, you know, so you kind of look at these areas, and you're not going to have like, oh, if I do this, it's going to make this condition better. You just start fixing stuff. You know, you just start fixing it, and sometimes you can tip it back in the other direction, but it takes a skill set to do it when it becomes systemic. But I mean, you guys have been treating them for a while, and I mean, I would give it the old college try here. Like it will, I mean, it will definitely improve our quality of life, but the knees are bone on bone, like,
Mhm.
you know, so you're just always going to be managing that scenario. You know,
Right.
there is no good thing where you can just go, oh, I did this and it wiped it out. When it's bone on bone, it's just you are managing that all the time. And so just try to stay on top of it the best that you can.
Okay. All
Yeah.
right.
Yeah.
Thank you.
Yeah. And you know, everything that you're doing, I mean, I usually don't go into this like too much, because a lot of times, you know, we could sit and talk about arthritis for like 2 days, but you know, it's not common. But like what's happening here, it's not common, but it's also not uncommon. Like when somebody has, it actually can happen faster with hips. And so like when somebody has a hip like that and it's bone on bone, it's like, we need to do this because, you know, we need to keep it from going systemic. And so, you know, even with that, there's this issue that like the person needs to exercise, but then at the same time doing weight bearing exercise is also grinding those bones together. Like, you know what I mean? So it's like, in the old days, like back in the late 1800s, when somebody was bone on bone in their hip, they became bedridden. Like they would not let the person get up, because it would literally shorten their life because of this systemic issue. And then over the years, they got much better at managing the inflammation, where that was not the case, right? But back in the old days, it was what it was. And so just keep managing the inflammation in as many different ways as possible, and just start correcting things, because at this point it's going all over the body, and it can tailspin much faster unless you start just addressing everything.
Okay.
If that makes sense. And the immune system being like top priority.
All right.
Yeah.
Okay. Thank you.
You're still welcome.
And then go ahead, Megan.
Hey, Miss Megan.
Hey, wanted to ask you about the next person in my family with ADD.
Okay.
Be my husband. It's also mild like Arian. He doesn't have trouble keeping a job or, running errands and getting stuff done. But, and I don't know what type out of the 7, nothing really stood out to me. But what I see, regularly is like, he's just kind of hyper, kind of loud, it's really hard to communicate with him verbally. Like I either have to repeat it, or most of the time I just do text and email, because he just, has trouble like listening. And then if I get his attention, his mind wanders after half of a sentence and that type of thing. So.
Okay. What's his workload? Has it been this way for a long time, or has it just been recent?
No, yeah, he's always been like this, but I would say after we had the kids, starting 10 years ago, there's just always noise and always distraction in the house. So now it's really, really hard to communicate, just like have any conversation. But without the kids, it was like he was that way, but it didn't cross my mind he had ADD. After I read the book and had him read some of the book, he's like, wow, this actually sounds right to me, explains a lot. It was kind of.
Oh, really? Okay.
Yeah. But
Um,
yeah, I don't know. What do you think?
how much of it do you think could be fatigue on him?
Yeah, it could be. So I had him start to do the preparing the basic and some of the other segments in materialization one, and then do mugwort on the joints of the arms and legs. And he has had an easier time, like kind of like getting through a conversation since then. And like he's
Yeah.
more around the house, like he's just doing chores without being asked. And I'm like, oh, this is nice. This is keep on doing that. So definitely agree with the fatigue.
He looks like he has a little bit of brain fatigue, is what.
Yeah, I would say. I had him do a Dalmatian sage bath last
Yeah.
week, and so I
lots
think-
of sage, and then like rosemary or basil. And I would probably do the basil like internally, a few drops in water, but like every day, like every day.
okay.
He could start the morning with the rosemary, but he like go heavy on the sage, like bath, drops on the wrist, inhaling it before he goes to bed. Yeah, like I would do that, and it's not immediate, but over a period of time, like over a few weeks, maybe a month or so, there should keep being like these little movements of where he gets like more cognitive, like more functional over
Okay.
a period of time. So as he starts doing this, like I'd say a couple weeks into it, add cinnamon to the mix. I wouldn't do it right now, but
Okay.
like give it like 2 or 3 solid weeks, and then have him start doing some cinnamon. And if you wanted to do something like right now, I would do like some soft form of thyme. Like you could do the thyme for like 3 or 4 weeks, and then after that switch over to cinnamon. Both of those need to be internal, so in water, and then have him drink. But they'll strengthen his body, they'll strengthen the brain. As it gets a little bit like further along, one of the things that I like to do with adults when they have this issue is have them do frankincense and myrrh together. And the reason is it kind of like jumpstarts the endocrine system, and it just makes all the glands produce the hormones and the the material that they're supposed to,
Okay.
and so the issue being here, like doing work on the endocrine system is a little bit complicated, because there's so much communication between everything. But also part of what happens with lymphatic function is the glands can be producing the hormones, but they might not be hitting the delivery sites.
Mhm.
And that is usually poor lymphatic movement. And so like I like to do this in stages, so that like when you see a stage and you hit the problem, you're like, the problem is
Yeah.
whatever it is,
Identify
and then you
which
can
thing.
double down rather than just doing a shotgun approach, right?
Yeah.
And so I like the sage, the rosemary, and the basil right off the bat.
Mhm.
You could add thyme, or you could wait a few weeks and add the thyme, and then eventually switch over to cinnamon or cassia. Like the
Mhm.
thyme that I would use would be like thyme linalool or Thuyanol, benchmark thyme, one of the softer thymes. I mean,
Uh-huh.
you could use red thyme or white thyme, but the other times would be kind of like what more well tolerated over
Okay.
a period of time, like no overheating and things like that. And then eventually the cinnamon.
Okay.
And when you do the cinnamon, you can drop the thyme and move forward with the cinnamon. And so you'll get the strength back in the body, and let that all kind of roll for a little bit, because even cinnamon is very strengthening to the brain. It's not what I would use right off the bat, but over a period of time, it's helpful, right? And
Okay.
then as that kind of sinks in, then do the thing with the frankincense and the myrrh. And I just
Okay.
usually use the 3 wise men, and I have them adjust a few drops. I have them wear several drops on their wrist, and a lot of times I do like a ointment or a body tonic, like on the feet, or have them do salt baths, and it just keeps jump starting all the glands. And then at that point, if there's still a little bit of an issue, then I go deep on the lymphatic function. And a lot of times where I target is not the arms and legs, but the gut, going back to what we were talking about before.
Okay.
So topically, the digestive lymph, and then I don't know if we have this on the site. We might not. There's a oil called C. odorum. It's basically, it's a form of cumin, right? It's not the black cumin. It's a different kind of cumin. I mean, it smells like Mexican food. You know what I mean? It smells. It's for accumulations and toxins, but it's really super strong detox for the gut.
How do you spell that?
Okay.
Like C period and then odor
Oh.
with UM at the end, like odorum, like odor.
Okay,
Yeah.
we definitely don't have that on the
Yeah.
site yet, guys.
I can put it on. It's not expensive at all. It's like, it's cheap. Like it's just, it's one of those ones that it's a strong, weird smell, and we just use it in therapeutic applications. And so, you know, we have several things that they just don't make it to the site unless we need to give them directly to somebody or something. So if you want to you know, just email and just say the lymphatic thing for the gut, and I'll know what you're talking about.
Okay.
That would be towards the end though. Like I wouldn't
Yeah.
even worry about that for 6 weeks, 6 to 8 weeks.
Yeah.
Because most likely everything we've talked about will probably resolve it.
Okay. So do you,
Most likely.
I mean, do you get a sense, do you think he has ADD, or do you think it's just
Well,
brain fatigue?
brain fatigue, like ADD is like a kind of brain fatigue.
Okay.
So I mean, just different
Kind of
terminology.
doesn't matter what it
No,
is.
Like it
Okay.
is what it is. I mean, there can be little nuances for the different types, but a lot of times I just, you know, like I use this term, but it's not a nice term. It's like cleaning up a crime scene. You know, you wipe down all the big pieces first, and then you start fine tuning.
Yeah.
Like when there's brain fatigue, you just start correcting some of the fatigue, and then you start dealing with the little nuances.
Yeah. Does I always think about psychic attack in his case because his family is a little.
There's probably a good part of that.
That
Stress could be a
cause-
part of it. I mean, aches and pains, mental stresses, mental pain with work, or weird things with the family. Psychic attack can be very depleting to the brain. Yeah.
Yeah.
I'm right there with you on that.
I'm having him do that booklet too. And I feel like he's coming back to life a little bit after
Yeah.
about a month of kind of doing some stuff. So,
I
okay.
mean, think about like, it is literally like when we look at it from the other side of the coin, it is literally what we call like automatic behavior, and automatic thinking is you don't have the energy to process what's happening in front of you a lot of times.
Yeah.
You know, it's just it's not even that your body's tired, your brain is tired, you know, and the brain gets tired with like inflammation and too much sensory information going to the brain. So, you know,
Yeah.
more lymphatic function, psychic attacks, stress, all those things can be super overstimulating to sensory nerves that then eventually cause the brain fatigue. And so, you know, pain, any of these can do it. And so I'd unwind the brain fatigue first, because literally the rate of healing for you physically and psychologically is tied to how well you can kind of cognitive process things. And if the brain is fatigued, you're just always in that phase of responding without being processed by your brain. You're not really thinking anything out. And it's not because they don't have the ability, they don't have the juice to be able to process. You know, their brain is just tired. They only have enough juice to get through the day and cover their chores and then lay down and stare at something. You know, it can be like that.
Oh yeah. That minus the chores was
Right.
a number of years.
Well, it's being polite, you know.
It's okay. And then I was gonna, yeah, and thank you for the marriage seminar. I'll be using that as well. I wrote a lot.
Yeah.
And then with Aryan, like I said, I've seen some good things popping up. It's kind of been,
Tell me where we at with treatment. Where are we doing? with
yeah,
treatment?
nothing's
So
really
far.
changed. You're saying what the treatment
Yeah,
is?
what are we doing at this point?
It's written down, but let me go what I remember. It was the same pattern. The first oil, we're doing helichrysum, then, okay, these aren't going to be, I won't remember in order, but it was like, there was galbanum, there was Dalmatian sage, there was blue healer, that was the last one. I'll just get the baggie. It's like right in the next room. I have,
I get the gist of it.
Okay.
You have to get the back.
and it was front heart, back heart, forehead, back head, and we just did like 3 or 4 breaths per chakra, and we're doing it about every other day.
Okay. And like, how has been the progress?
So it's like been, I think, close to 4 weeks, and there's just a few things that are better. Like he's just noticing what's going on around him more, like he's just taking in more, kind of like what you were talking about. And then like he's been a little bit nicer to assist her occasionally, but mostly he's just kind of hammering her and, you know, hammering me, asking me for the same thing 20 times a day after I've already said no. So like the improvements are like they're not every day, they're not consistent, but I just see it occasionally, whereas before it was never. And I haven't seen any changes since I talked to you about it last, which was like 1 or 2 weeks ago. It's kind of been about the same. So I don't know if we can amp it up.
Let me do a little evaluation here.
Okay, thank you.
Okay, so this is what I would say is you know, here's a difficulty sometimes when we talk about things from the point of view of like being like symptoms, is because we look at it, and I'm not saying you're doing it, I'm just saying like this is why my explanation is like this, is we look at it like kind of through a microscope, like, oh, this is happening and we need to address this, and we really don't take in like a bigger picture of like, but why is that happening?
Yeah.
You know, we might think about it, but we don't really look at like there's 8 different reasons why this could happen, or 10 different reasons, and they're not always going to have like the same treatment. And so his adrenals are overactivated. Would you, I'm just curious, is he a little bit anxious?
So I've never heard him say he was afraid or anxious about anything, but he's just really wound up, just in
Okay,
general.
I would still call that anxious or anxiety.
Okay.
Yeah, like just being wound up, but like anxiety is not always about fear. It's just like a kind of like a sort of agitation of sorts, right?
Yeah, he's definitely, agitated.
Yeah, so like it can just be like it feels like a switch is on that shouldn't be on and I can't turn it off. Like,
Yeah.
you know, it can just literally be like that.
Yeah.
And so in certain situations, like it, you know, when you see somebody where they're a little bit agitated, you go, okay, let's deepen the breath, let's calm down the endocrine system, let's calm down the adrenals. Calming down the adrenals, I don't know is going to do anything. Like, you know, it's not addressing, it's not like they just got stimulated and they're just stimulated, right?
Yeah.
There's a reason why they're still stimulated. And I would say that the agitation is in his whole like nervous system, the central nervous system.
Mhm.
And so the issue here that makes it a little bit more complicated is that you take something like valerian or spikenard, which are somewhat like sedating to the central nervous system, but when somebody has like ADD, it acts as a stimulant, because
Yeah.
it's a paradoxical response. And so I would go softer. Like I would go with like clary sage, melissa. I would go with like maybe a chamomile. Even inhaling something like kava could be nice. Lemongrass. Lemongrass wouldn't be my top one, but I'd probably go like clary sage, melissa, kava. I'd probably stay away from the spikenard and valerian for right now.
Okay.
But you could also do like mandarin. Mandarin would be helpful.
I
mean,
have a
it's not
green mandarin. Does that work?
Yeah, that'd be fine. Yeah. And it's not going to be like super sedating, but it was just going to be kind of calming to the central nervous system. It's, basically you're looking at what you would call sedating the nervous system. And in the old medical aromatherapy, and even like in the old Greek tradition and things like back in the ancient times, is they would say the use of a hypnotic, right? And the hypnotic, it doesn't mean you hypnotize somebody. It just means that a hypnotic, as far as like oils are concerned, is something that changes like their thought process. Like it makes it like kick out of like the loop. You know what I mean? It
Yeah.
doesn't mean you're changing their mind. It's just like you're helping to engage other parts of their mind other than the one piece that it's just like stuck in. You know what I mean?
Yeah.
And so like it allows him to go to his chill version, or his like, yeah, everything's okay, or like big picture, whatever it is, right?
Yeah.
And it's just, it pulls him out of the loop. And
Okay.
a lot of times how you do that is, they call it hypnotics, but basically it's just a fancy way of saying you sedate the nervous system. So, you look at like kava, for example, like one of the things I used to do in the old days is in the like the Polynesian traditions, like Hawaii and New Zealand and things like this, they do this thing called an awa ceremony. And it's basically you just take in a bunch of fresh kava and you do these prayers and you do this little thing. And the term means like doorway to God. And it basically just pulls you out of your normal everyday thinking for a little while. That's all it does. It just, it sedates everything so that you can just go, okay, I don't have the constant bombardment hitting my brain from all my senses. I'm calming everything down. And as I look around, like I can think of something outside of myself. Because really that's what we're striving for here.
Yes.
Being able to see something outside of what I want, what I need, what I desire, my urges, like, just consumed with the self. And so that's why they call it a doorway to God. That is literally moving from, the self to like starting to be of others or divinity or whatever it is. And so this is why spikenard is used through the ages, valerian, clary sage can do it. Melissa, we do this for little kids with melissa. I have a couple more. Let me look it up on my booklet. I think I called it doorway. Another one we did never put out. It's in progress.
Would you do the same pattern with these that I've been doing, or just diffuser and salt bath?
Yeah, you could do the same pattern. Yeah.
Okay.
Yeah, same pattern. Okay, so other ones are neroli or Pettigren would do it as well. There is a neroli Pettigren. I don't know that we even have that one on. All I'm doing is talking about things we don't have on the site. But I mean, any
I
of
did
those.
Pettigrew just once in his diffuser like a long time ago. And I can't remember. It seemed like I had a good result and then I just kind of forgot about it. I was just
Yeah.
thinking about braids.
Like any Pettigrew will usually work. I have this weird blend that I use for treating certain conditions. But in it, I use neroli Pettigrew. It doesn't matter. Honestly, it doesn't matter. Like it's just like neroli Pettigrew or Pettigrew, clary sage, melissa, kava. If you have the oil, he can just inhale it. He doesn't even need to take it internal. Or you could give him a little small dropper full of like the herb from the health food store. See if that works. I mean, like kava starts to be a little bit of like, because like sometimes there is a paradoxical response. And so if you notice that he starts to get hyper after he takes it, we need to treat the brain fatigue more before you can really do that next phase.
So
if you sedate the central nervous system, in this particular case, it will calm down his adrenals.
okay.
There's things that you when you want to go directly to the adrenals, you use very specific things. None of them are this. Like, what I mean? Like you would use other things. But here, when I look at him, you can try sedating or regulating his adrenals all day long. The agitation is in his central nervous system. It's not going to resolve itself. It's just, even if you calm it down, you'll calm it down for a night. And then the next day, central nervous system goes, let's get back up to speed here. You know what I mean? It's like,
So with the paradoxical nervous system, is that something that we are going to go after at some point, or is that kind of
you already are doing it? Yeah,
it will. Okay.
Okay. Paradoxical responses in the brain is another way of saying ADD, ADHD, and it's another way of saying brain fatigue. Yeah, they're all the same thing. Like,
that's so interesting.
People will try to split hairs, but really when you get down to it, it's just different fingers that are all pointing to the same thing. They have different explanations, but it is the same exact thing.
So can I just one more? I don't want to take everyone's time, but this Dr. Amen was saying it runs in families, almost like it's genetic. But if it's really genetic, you can't just heal it with essential oils. So then is the mother's stress level, like I'm having a crazy time with a new baby, freaking out, arguing with my husband, is that gonna like cause brain fatigue because he's getting hammered with his environment?
I mean, it's hard to say. I mean, I'm very familiar with his work, and he does a lot of brain mapping but I would say like sometimes this can be like emotional patterns within the family. Sometimes there is like saying something's genetic. There are things that are like in your DNA, and then there's things that like the predisposition to like the glands working in a particular way. Doesn't mean that they can't be treated to behave differently. But like you could almost call that genetics, but it's genetics that can be shifted. Where there's some genetics where it's just you have this issue, like your body just doesn't do certain things. Like there's certain things where like certain people don't have a particular enzyme in their body to process chemotherapy, and chemotherapy is potentially fatal almost immediately. That's genetic. That's not changeable. But something where how the glands are working, that could be treated. It might need a little bit more effort than somebody else, but it still can be treated. It still can be treated.
Got it.
And so this one I would throw into that. Like I understand what he's saying, because he's looking at patterns. He does really amazing work. He does patterns, but at the same time, there's not a differentiation of like how you got there.
Yeah. Okay, awesome. Thank you so much.
You're still welcome.
And go ahead, Heather.
Hey, Heather.
See about getting you unmuted. We'll come back.
Okay,
Oh, no, we got
hello.
you.
Hey.
Hey, I was going to type in because I'm having a terrible sore throat. Um, what I've been doing, yeah, it feels like my throat is cheese grated and I'm
Ugh.
gagging all the time. So I've been diffusing basil. I've done the salt water with basil gargle. I've even taken drops of Ravensara in
Okay.
water. But I'm just wondering if there's anything
Do
else
you have
that I could be
Baylaurel?
doing.
You have
No.
Baylaurel? No.
No, sir.
Ravensara. Yeah, usually with a sore throat, we try to hit Baylaurel. I mean, it doesn't always work, but I mean, we don't think you have like strep or anything like that, right?
No, not strep, but the whole virus was going around the office, so I think
Okay.
that might just be that.
Okay, so basically you want to clear out lymph nodes.
Okay.
Let's see, Baylaurel would be number one, but I'm sitting here, I'm thinking this out a little bit.
Sure. And the only other thing I really have is kind of like congestion into my ears a bit.
Yeah, okay, so that's sinus. Let's have you inhale the basil a lot, or if you have rosemary, something like that,
Yes.
to widen the sinuses.
Yes.
A little bit of thyme, because are you like really clogged up in there?
No,
Okay,
it's just
so
bad
rosemary or
for-
basil then. Rosemary or basil. Even helichrysum can be good for just reducing some of the inflammation in the area. Even myrrh, but I try the first three before that. Sore throat.
and just more so inhaling, not necessarily
for that, for the
drops in water.
sinuses, yeah, just inhaling. Like but let me look something up real quick
because
before I go.
like through the nostrils I can breathe totally fine.
Okay. Yeah. I mean the ears can get like kind of clogged up or achy. Actually, let's have you do this. Do you have like hyssop or like
Yes.
myrtle? Okay, let's also have you like inhale a lot of hyssop. And
I've been doing that too.
Okay,
Okay,
good.
cool.
Because the thing is there's inflammation in the ears, but also part of what happens when there's like something going on up in the nose and throat and everything, it makes it harder for this muscle, these two little rope muscles on each side of your neck, has to work harder to elevate the rib cage to help you breathe. And so it starts to cause weird dysfunctions in the ear. And so I suspect that the ear's a little inflamed. And so I think if we just unwind everything, it should improve. The hyssop should probably help that along with the other things that you're doing. But I want to hit the lymph nodes here. Give me just a second here.
Sure. Thank you.
Okay. Do you happen to have turmeric?
Not in oil form, only like powder for use in cooking.
You think you could handle taking a little bit of that and sticking on the inside of your lip?
Oh yeah.
Why don't you try that?
Okay.
And what about ginger? Do you have some ginger?
Gosh, ginger oil's at work, but not with me. So
Do
negatory.
you have like a ginger tea or anything?
Maybe. I'm not.
If
I'm
you
not-
have some ginger tea, I would do a little bit of the ginger tea, but I would take like a little pinch of the turmeric and stick it inside your lip like you're chewing tobacco, and just let it be in there for like a few hours. But like swallow the juice.
Okay.
You know, like you usually, like in the old days, I wouldn't use powder. I would use like a little root and like stick it in there and just let it kind of soften up, and then over a period of time, like eventually toss it. But if you have turmeric powder, just take a pinch and like kind of like put it in a little ball somewhere, and it is going to like spread out because it's powder.
Yes.
But if you end up like drinking it, okay. Like really at the end, you could also just put some water in your mouth, swish it around, and just drink whatever little pinch is there. Try doing that.
And this is for the lymph nodes?
That is for the sore throat. Yeah, that's going to
For the
help
sore
clear
throat,
out the
okay.
lymph nodes, and
Mhm.
you know, the ginger potentially would help. My experience is like if bay laurel doesn't work, the turmeric will usually nail it.
Okay.
Yeah,
I will.
like if you had the oil, I'd probably have you put a couple of drops like on your tongue, like gargle, like put a few drops in water and gargle with it, and then put a couple of drops on your tongue, and then just call it good. But here, like you just, you know, take it and just put that in there, or, you know, if you had a drop or two of the oil, you could put it along the inside of the lip. But, you know, sometimes we just got to do what we got to do with what we have. And
Right.
if you have some turmeric in the house, like it's stick it in the lip, and that will usually, it will take a few hours, but you should start to notice that like the lymph nodes are starting to open up, and the soreness should start to dissipate within, like, usually my experience was probably about 4 hours or so.
Okay, maybe when you say lymph nodes, that makes me think how I describe what I was feeling sometimes is like there's like a balloon pressing on my esophagus. So that must be
Yeah.
what I was thinking of, is
Anytime you
lymph
have
nodes being
soreness,
swollen.
anytime you have soreness in the throat, it's always lymph nodes. Like lymph nodes are
Okay.
just like your lymph nodes will get backed up in this area, and they get backed up, but they also, that area just gets like toxic, right? And so
Yeah,
you want to
it's
open that
nasty.
up. So yeah, so it just flushes out.
Okay, thank you very much.
You're so welcome. And if in a day or two it's not getting better, let me know.
Mhm.
But
Okay.
it should start to resolve.
Will do. Thank you very much.
You're so welcome.
Go ahead, Shraddha Ananda.
Hey, hey,
Hi.
hey, hey. Yes.
So a few things. One, I just wanted to give you an update. Thank you so much for the help with the scaling syndrome and the paradoxical breathing.
Oh, good.
So the scaling syndrome has lessened quite a bit, and I think it just depends on what I'm thinking about or what I'm doing in the course of
Yeah.
the day.
Yeah.
I can feel it tighten, but thanks to the
Right.
protocols, they
And keep doing so it is feeling like it's moving in the direction of being resolved, and
yeah.
it does take a while, but like if you just keep doing it over a period of time, like you said, like stress or getting upset or fatigued. Fatigue is actually a very big thing that causes the scalings to go out, by the way.
Yeah.
Your breathing will change, and the scalings will start to trigger again a little bit. So, it sounds like you're super aware of it. Just keep doing it, give it some time, and, it should resolve itself. There's ways of getting in, like in a painful way, like manipulating those things, but it is incredibly uncomfortable.
Yeah, I was blessed with a fascia release treatment from Kathy, who's on this call right now. Kathy
Oh,
Fulkers.
tremendous. Yeah.
She used some tuning forks and
Oh yeah, that should work very well for that.
and,
Yeah.
and so since that treatment, I would say everything from almost the xiphoid process up is 50% better plus the
Good.
oils. So, I also told you I was going to follow up with all these specialists and stuff that my doctor wanted me to follow up with. So I got a breathing test the other day.
Mhm.
And I thought, okay, now they will see that I'm not crazy. And I paradoxical breathing through the roof. I mean, I was double exhaling and panting, and I just could not get my breathing regulated. And the crazy thing is, after all of that trouble, the doctor looked at the results and he said, your oxygen levels are great. There's nothing wrong with you.
Yeah, they're just looking at oxygen levels there. It has nothing to do with like the breath itself. Like,
Yeah, I was a,
it's like the thing with the breath is it's a functional problem. It's not necessarily
Yes.
a medical problem. And so, he's looking at the test like how much oxygen are you getting in your blood? Are you able to, he's looking for certain markers. He's not really looking at it from the point of view of function. He's
Right.
just looking for medical conditions. And so
yeah,
I mean, it's a different tool. Like, you know what I mean? That's why
right.
it's like when you kind of combine the both, it can be a very accelerated healing process depending on the condition. But sometimes orthodox medicine is more appropriate, and sometimes, more of the functional medicine that can be more appropriate because, they're looking at different things.
Right. Yeah.
Mhm.
So that's my update about that. And I'm going to, I found a DO who specializes in myofascial release.
Oh, tremendous.
And I'm going to see
Yeah.
them in 2 weeks. So I'm looking for even more improvement.
He probably can go directly onto those scalenes and work on those.
Yeah.
I mean, it's usually a chiropractic adjustment or like a neuromuscular specialist, or sometimes you'll get a sassy physical therapist that will do it.
Right.
Like that they have had, people that have had that issue, and they'll get in there and just go right at it. But usually an osteopath, sometimes a chiropractor.
Yeah. I'm looking forward to it.
Yeah. It's a
So
delicate area because you're working in and around the brachial plexus, and so you can't just go poking in there. Like, what I
Yeah.
mean? You have to.
Yeah.
That's why I kind of like those tuning forks for something like that. You're doing it in a way where it's not as painful, it's not as intrusive, and yet it still gets the job done.
Oh yeah, she was absolutely amazing with it. I'm so grateful for both
Yeah.
of you and the help. So 2 questions. I don't
Mm-hmm.
know if the answers are going to be quick or not, but so COVID helped exacerbate this paradoxical breathing to make me aware of
Yeah.
it.
Yeah.
And so now what I'm finding is, so I'm not nearly as fatigued. I can do maybe like 2 or 3 full days in a row with work and everything. But what I noticed today, and I'm sure it's been happening all along, I'm just getting more and more in tune, I guess, with what's going on. It literally felt like, so I was trying to take a timed language test, and it literally felt like the neurons in my brain, like there was something in between, and they just could not
Yeah.
connect correctly.
Yeah.
And I'm just wondering if, like, is there something I can do to heal that, or do my neurons just have to
Treating the
rewire?
stuff that you're doing is actually the treatment, because the thing is like you're basically like describing what we would call afferent and efferent, which is just like the movement of like neurological impulses.
Uh-huh.
And what happens when you have paradoxical breathing is it just kind of gets scrambled. Like, so your nervous system isn't quite functioning like it normally does because the breath is off. And so a lot of times correcting the paradoxical breathing will also regulate that. There are times where if you do need to help like re-educate the neural pathways, or like calm down the nerves, you could use like vetiver or sage,
Mhm.
just inhaling. You could just even rub it on the neck a little bit. not because the next anything's like special or going to do something, but it just, you're getting it kind of close up to the head. Like I tend to like to do it like at the base of the skull on the backside.
Okay.
You could also do it in the temples. That can be helpful, but the big one is correcting the breath. Like if you
Okay.
can correct the breath, I didn't say this when we were talking about it because I don't think you really have this issue, but like when you're looking at like the breath, especially like the paradoxical breathing, and you could say this also for like anxiety or something like this. There's like these different like phases what you're treating. You're treating like how rapid the breath is. You're also treating how we were talking about a little while ago, like how it's impacting the central nervous system. The rapid breathing, you can slow the breath down sometimes with the use of a Lang Lang. Lang Lang actually is very good for kind of calming the breath down a little bit. It doesn't deepen it, but it just can slow down a rapid breath, right? And then you follow it with Spikenard, which continues to slow down the breath, but it starts calming down the central nervous system like we were talking about. And here you're talking about how the nerves are firing. Again, like sometimes you would calm them down. And then there's other times where, like depending on what stage of therapy you're in, you might actually use like a body stimulant like forest mint or peppermint to like jumpstart the nerves the way that they're firing through the body. I don't think you're at that phase yet. Like I wouldn't worry about that part. I think it's probably going to resolve on its own. But the other thing is go through and do, what did I say, Lang Lang, Spikenard, and then you deepen the breath with like the hiss up and unwind that. But the one that can happen sometimes, and it's not so much about the lungs. This is actually more for like the trachea, like the upper part of the respiratory tract, like that's more like in the throat, is you would use like, sometimes what happens is that the area here starts to like constrict, and like the diameter of the throat like reduces. And so even though the breath is getting better, you still have this issue with the diameter of the throat. And in those particular cases, what we would do is use it's very specific. It's this oil called Tolu balsam, and you can inhale it, but usually what I do is I have people put like several drops in their hand with like a little bit of lotion or oil and just like rub it up on the upper chest. And you got to do it like a couple of times a day, and it's a very pleasant smelling thing, but it helps to loosen that tension in the throat and allow the throat to open up, which is like the trachea, the esophagus, all that kind of smooth muscle in there. The only reason, like if we're problem solving and things just still aren't responding, that's the thing that I would go to.
Okay.
I don't think you have that issue, so I didn't mention it when we were talking about it way back when.
Okay.
But it's always a potential. And then the other thing we look at is like the swallowing mechanism. Like, are you having any difficulties swallowing, or like?
No, that's how the
gulping
doctor
air?
ruled out Guillain-Barré.
Right. Okay. And so the other thing is like, just from time to time, do you go?
Oh yeah.
Okay, so that is anise. Start taking anise a couple times a day in water, like, or even just
Okay.
once a day, a couple of drops in water,
Okay.
because that is, it's not really a medical condition, although sometimes a doctor will acknowledge it. But in functional medicine, it's called like aerophagy. It just means gulping air.
Yeah.
But it's tied to the function of the nervous system.
Okay. Yeah, that's what I do when I wake up in the morning. First thing,
Yeah.
like I haven't been
Gulp.
breathing or something.
It's like and it's kind of weird. It's like, it's not even through the nose, it's through
No.
the mouth.
Yeah,
So-
like I'm coming up from water or something.
Yes, exactly. So that's known as aerophagy. And so the anus or anise, however you want to say it,
Mhm.
it's balancing to the involuntary part of your nervous system. And one
Okay.
of the things that it does is it helps to regulate the swallowing mechanism, and it helps to regulate that gulping.
Oh, thank you. Okay. And my last question was, and maybe this is all related, because I feel like when I eat, like I feel like my body's not absorbing the nutrients, and maybe I'm not even digesting the food. I mean, I have a full digestion, like it goes all the way through, from top to bottom, but I just feel like I'm missing nutrients or something. Like
Yeah.
I may as well have been eating
Again,
here.
that probably is a little bit related. Just the nerves in the gut can be a little bit off. I would try doing the digestive calm, the body tonic.
Yeah, I've
Like
been
rub
using
it,
that.
yeah, rub it on the abdomen just as you keep unwinding all the stuff, keep rubbing
Okay.
it there. You could, I mean, the anise actually might also help that. Rosemary could help, but I would say let's have you do the anise first, but then
Okay.
like maybe after a week or two, when you see that the gulping is going down, because we want to be able to see that a problem's resolving somewhat. Right? It
Okay.
doesn't have to be completely, but it's like, we're moving in the right direction, right?
Okay.
The thing that I would probably put you on is cinnamon or cassia. Probably it would be cinnamon leaf.
Mhm.
And so here's the reason is, so for one, it helps stimulate digestion, and basically like assimilation, right?
Mhm.
It helps the rhythm or the movement of the digestive tract. And then the other thing that it does that's not associated with digestion, it is when the breath is weakened, like when like you're just not breathing as hard as you should be, like it's
Yes.
like it's a weakened breath. You have a couple of choices that help to resolve that: thyme and then cinnamon. And with the things you got going on, I'd lean more towards cinnamon.
Okay, ingest it, couple of drops.
Yeah, that would definitely, like, you a couple drops in water, like
Okay.
at the beginning of the day,
Okay.
day.
Thank you so much.
Inhaling might work, but ingesting it here is so much faster that I just wouldn't even mess around with trying to do it. Through
Okay.
inhalation. I just go for it.
Okay,
Now, be sure to put it in a lot of water because it will make the lips tingle and things like that.
okay,
And it could be juice or whatever, but and then drink it.
alrighty. Thank you so much,
You're
Brett.
s-
Appreciate
You're
it.
so welcome. You're so welcome.
I mean, it's pretty much time. Troy's hand is raised. Barbara's unmuted.
How about we'll switch over to angels and still do a couple, and then we'll do some questions for angels and then a little practice.
Okay, so
So how about like Troy and Barbara, you still have questions? Let's switch over to the angel. I'll still answer your guys' questions, and then we'll do Q&A for some angels and then do a little practice.